Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a really common condition within the hand called trigger thumb or trigger finger. But before I begin, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So I'm going to talk about this trigger finger, trigger thumb situation. So essentially what trigger finger is, it's when there's a nodule which forms within the sheath of the tendon of the hand or thumb area here. So within these tendons, there's a sheath, a covering that goes around it, and as a result of this inflammation, this nodule will form within this sheath. And then when we're trying to do these different flexion type of movements, what will happen is this nodule will kind of get caught, and as a result of that, when we're trying to go, for example, if it's in the thumb, if we're trying to go back into an extended position, the thumb will be stuck, and then we'll get this response that's really painful where it'll kind of fling back very quickly as that nodule moves through the sheath, and it'll cause a lot of pain and discomfort. And so typically, right, the way that you would treat this is, number one, there's typically a period of time in which you want to immobilize it, and this might take up to 4 to 6 weeks, where you'll wear a brace that prevents if it's in the thumb, prevents the bending from occurring. So you can have a brace that goes like these very small braces, which prevents flexion within that area. Now the reason for that is to try to reduce that consistent, basically break the cycle of that consistent irritation taking place and reduce inflammation. Now from there, what we want to try and do from a mobility and exercise perspective is try to break down the adhesion scar tissue within that nodule. So there's something called frictions that can be done, and with frictions what you would do is typically it's going to be down in this area, right, typically where this nodule will form for the thumb, for example. And so you would actually put, and you can put maybe one finger over the other and put direct pressure perpendicular to where that nodule is. And again, it might be a little bit sensitive, a little bit painful, and you would do for about 2 minutes. Now again, this typically would be after a period of time of immobilizing it. From there, other things you can do are just some thumb extension stretches back. Okay, and I also like to put do some soft tissue work around the muscles that surround the thumb, because what I find with a lot of these patients is that there'll be some spasm or some protective spasm around the area of pain, just like any other area of the body. If there's been if there's inflammation, if there's pain, typically we'll find this protective spasm to prevent movement. So I like to either use my other hand and put sort of direct pressure right along, this is called the thenar eminence, or a tennis ball in through here, just to try to free up, right, the movement through that particular area of the thumb. Now this would be the conservative approach to this. So and the hope again would be that after the immobilization period and after doing the frictions, the stretching, that it will free up this movement, and that nodule will have reduced, so it's not getting caught and then causing that pain, that situation where the thumb quickly goes into extension, right? Now for some patients, unfortunately, it doesn't completely go after just conservative treatment, and for them, they might have to look into a cortisone shot perhaps, or there is a surgery for that to actually remove the nodule there. If you have any specific questions, concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.